So Neal, since the recommendation, tell us a little bit how this has impacted your practice. What's going on with your referring doctors? How have they responded? How is this? What are your patients saying when they come in to see you and your partners in Myrtle Beach?
Well, I would agree with some of what Mark had said. I think that when the task force gave it a letter recommendation of D, and the snippets that went out into the mass media, basically the interpretation for many of my patients was this whole thing is really unnecessary. I don't really need to have PSA. In fact, no one dies of prostate cancer, and we all know that's clearly not the situation. So I think it's created terrible misinformation in the public. I don't think the task force wanted to do that. I think they were trying to better address issues of over-diagnosing and perhaps over-treatment, which are very valid issues, and I wouldn't argue with that. I don't think any of us would. But it's created terrible misinformation in my clinic population. I think from a legislative standpoint, we're also concerned that with this type of a recommendation, there could be a failure to pay for PSA testing in the future. I know Secretary Sebelius has said that that's not the case right now, but she has the option, or her successor, to no longer pay for it with that type of a recommendation. That's very disconcerting. So we've also seen a decrease or a decline in our referrals from the primary care base. And as someone who's very involved in treating systemic prostate cancer for patients who failed localized therapy, I'm concerned that a future trend could be that we'll see more patients who are not appropriately diagnosed, who are not appropriately screened, emphasis on the word appropriate, who are at high risk factor, family history, perhaps African American, industrial chemical exposures, rapid PSA elevation, but you wouldn't know that if you haven't checked it. Regardless of the time frame, we may end up seeing more patients presenting to our clinics with advanced disease. And as was said, and we all know, it's the second leading cause of cancer mortality in the United States after lung cancer. So I have real concerns about it. We need to more judiciously know who to screen and who to diagnose and who to biopsy, no doubt about it. But it's not a one-size-fits-all, and the task force recommendation, at least for my patient population, seems to think and oftentimes accept that one-size-fits-all. So I spend a lot of my clinic time re-educating patients about it.
Paul, anything to add to that, to Neal's comments? Or?
Neal's comment is exactly one I'd echo. I spend more time every day explaining, even to my patients with prostate cancer, that the PSA test is not invalid. It is just an overwhelming burden, and I think the gripe I have about the task force is I don't think they understand the weight of what they said in terms of how the average man is going to see that front page headline and interpret it, and it's led to significant burden in our offices to talk to our patients.